my name is student Dr. Alexander Myers. We are second-year medical students at the Idaho College of Osteopathic Medicine, and we're working under the leadership of Dr. Helen Kuo at the Idaho Urological Institute. Today we'll be talking with you about kidney stones. Kidney stones are a common condition affecting more and more people every year. They can form anywhere in the urinary tract, including the kidney, bladder, and ureter. Kidney stones can form from various compounds. Calcium oxalate is the most common, but they can also be made from uric acid, calcium phosphate, and cysteine. Some people are predisposed to kidney stones for a variety of reasons. These can include certain diseases such as diabetes, genetic conditions, and lifestyle choices. These all may increase your chance of forming kidney stones. Kidney stones can develop in anyone, but there are some factors that make their formation more likely. Decreased fluid intake promotes the concentration of stone-forming compounds in the urine. Diets low in calcium, high in non-dairy animal protein, and high in sugary beverages are also associated with stone formation. Kidney stones can be painless and asymptomatic. However, if the stone gets stuck in the urogenital tract, you may develop severe flank pain on the affected side. This pain may radiate to your groin as well. You may also experience painful urination and notice blood in your urine. These symptoms of pain and blood in the urine often prompt patients to seek medical care. A primary care provider or urologist can work with you to help diagnose the cause of your stones and to reduce the chance of recurrence in the future. When you're being evaluated by a provider, you can expect to give a blood and urine sample. The physician will rule out an accompanying urinary tract infection and evaluate kidney function. Another important lab result will help rule out hyperparathyroidism. Imaging such as a CT scan or ultrasound will also be done to locate the stone. This is important because the location at initial presentation can help the physician understand the root cause, as well as determine whether you are likely to have new stones form in the future. Additionally, you can expect your physician to order a 24-hour urine specimen in order to assess risk factors and treatment response. If a stone is available for analysis, this can help to determine the cause and inform the treatment plan. High fluid intake is recommended in order to reduce stone formation in the urinary system. You should drink enough fluid so that you have at least 2 liters in urine output daily. Reduction in carbonated and sugary drinks may also help to prevent stone formation. Dietary changes are also recommended. Notably, you should be eating a diet with plenty of calcium. It's also recommended that you reduce sodium intake to no more than 2 grams of salt per day and reduce animal protein consumption to no more than 2 servings per day. Thiazide diuretics, such as chlorthalidone, can also be used to reduce the risk of stone formation. Certain patient populations are considered high risk for developing stones or for having recurrent episodes of stones. High-risk populations include patients with a history of previous kidney stones or those with conditions such as gout, hyperparathyroidism, diabetes, obesity, recurrent urinary tract infections, or malabsorptive intestinal disease. It's important to discuss family and past medical history with your provider in order to come up with the best plan and follow-up. Diet assessment and metabolic testing allow for the use of specific nutritional therapy that's more effective in preventing stone recurrence. Older women who take calcium supplementation should also be mindful of the increased risk of stone formation. Thank you for watching this presentation. We hope you found it informative and entertaining. We would like to extend a special thank you to Dr. Helen Kuo of the Idaho Urological Institute for generously sharing her time and expertise with us.